Finding the missing millions, it's the theme of the World Hepatitis Day, July 28, 2018, by the World Hepatitis Alliance. And this is a nod and an acknowledgement to the 290 million men, women, and children who are already infected with hepatitis, but they do not know it. It is estimated that 9 people in 10 who are already infected with viral hepatitis do not know that they are infected. So the World Hepatitis Alliance is starting a campaign on advocacy and awareness to progress towards WHO's elimination target of a 30% diagnosis by 2020. The campaign aims to tackle barriers to diagnosis by increasing public knowledge of the disease, promoting easily accessible testing, removing stigma and discrimination, and reducing out-of-pocket costs to the patients. So I will be touching on these during my presentation. As we all know, the global burden of viral hepatitis is very high. And this map shows the chronic hepatitis B, which is a global health problem. And we can see that, this is Myanmar. This small map is Myanmar, and it is painted in red, which shows that it is highly endemic for hepatitis B. So the National Serial Survey for Hepatitis B and C by the Department of Medical Research, Department of Public Health, and the Myanmar Liver Foundation in 2015, conducted to cover all the 14 states and divisions, showed that hepatitis B was 6.5% prevalent in Myanmar. But there's a wide range. It is 5% to 12%, the highest in Yangon, which is the previous capital of Myanmar. This map shows Myanmar with the hepatitis B prevalence during the National Serial Survey in 2015. It is the highest in Kachin, in Upper Myanmar, lowest in Kachin and Upper Myanmar, and highest in Yangon in Lower Myanmar. This histogram also shows the hepatitis B and C prevalence in the 18 townships during the National Serial Survey. This table shows the burden of hepatitis B by population, and it shows that in males, the prevalence is 9%, and in females, the prevalence is 5.5%. In the PWAITS, it is 7.3%, and among the blood donors, it was 2.3%. This is low because of the deferral system. So according to the WHO elimination goals for viral hepatitis, Myanmar is trying to be in line with the World Health Organization, and the National Hepatitis Control Program was established in 2015. And Myanmar has adopted the WHO Global Hepatitis Strategy into prevention and control strategies that are tailored to specific conditions at the national and subnational levels. The National Hepatitis Control Program during 2015 to 2018 has produced the following documents in book form. The National Treatment Guideline for Viral Hepatitis B and C, and the Myanmar National Action Plan for Viral Hepatitis, Myanmar National Strategic Plan on Viral Hepatitis, and National Monitoring and Evaluation Plan for Viral Hepatitis in Myanmar. So this is the National Strategic Framework for Myanmar. And the monitoring and evaluation steps are carried along the line. And there are 4 strategic directions. One is the prevention of transmission of viral hepatitis. 2 is the diagnosis, clinical care, and treatment. 3 is the workforce development. And 4 is the surveillance and research, and strategic information. So this also shows the strategic information framework, the minimum set of 10 core indicators to monitor and evaluate the health sector response to hepatitis B and C along the result chain. And this shows the national targets for viral hepatitis response in Myanmar for 2030. So in 2030, Myanmar may not be able to meet the global target in some areas, but we will try to be near the target, global target for viral hepatitis elimination. So I would like to give my presentation for two sectors, for the public sector and the private sector. In the public sector, for the control of hepatitis B, the government takes the leadership role for the prevention, diagnosis, control, and treatment of viral hepatitis. So as there is an effective vaccine for hepatitis B, immunization is a central strategy for Myanmar to reduce the hepatitis B burden. Another is the screening of blood and blood products at the blood banks and distribution of sterile needles and syringes. The major stumbling block is the low awareness of viral hepatitis, both in the general and gay populations. Knowledge of various risks and transmission routes is central to prevention of spread. So first, with the hepatitis B vaccination, which has been introduced into the EPI program in 2003, 15 years ago. And since then, 3 doses have been given at 2, 4, and 6 months schedule with other EPI vaccines for all the newborns in Myanmar. Also, the Department of Medical Research under the Ministry of Health has produced a plasma-derived hepatitis B vaccine and is also producing the recombinant hepatitis B vaccine at the hepatitis B vaccine plant. The local vaccines are used for the birth dose at the moment.
Excuse me, do we have another one of these? I think the battery is pretty low. Let's keep going. It's not working.
No, it's not.
This shows the hepatitis B coverage in Myanmar.
Just hit the green button. Yeah.
This shows the hepatitis B vaccine coverage in Myanmar in 2015. Because we are using the pentavalent vaccine. And it shows that in hard-to-reach areas, the coverage is less than 70%. But in a majority of areas, it is more than 90%. This also shows the hepatitis B testing and vaccination among the people who inject drugs and people who are using drugs. So they are the high-risk groups, and they have been vaccinated. Majority of them are vaccinated with hepatitis B vaccine. This shows the hepatitis B vaccination among the PWITs by states and divisions. Another prevention step is the hepatitis B screening at the blood banks, because it is one of the main modes of transmission for hepatitis B and C, by transfusion of contaminated blood and blood products. So to implement blood safety and testing strategies, we are testing all the donated blood in Myanmar for hepatitis B, C, and HIV, and laboratory quality control tests are carried out along the line. Prevention of unnecessary blood transfusions by establishing policies and practices that promote rational use of blood. And the national blood screening policies and strategies have been strengthened. The mandatory tests of viral hepatitis at blood banks have been carried out. And in Myanmar, the hepatitis B has been screened since 1988, first with the locally produced RPH reagents at the National Health Laboratory, and then they are expanded to the hospitals in the districts. In 2004, all the donors were donated blood were tested with rapid tests using ICT. In 2014, ECLA method and rapid diagnostic tests were used, and also nucleic acid tests were applied as required. So this shows the number of donors screened for positive for hepatitis B and hepatitis C. So in 2014, 15, and 16, each year, between 0.3 million and 0.4 million blood samples were screened, and hepatitis B positive shows a decreasing trend. 2.4% in 2014, 2.3%, and then 1.8%. And the test kits for viral hepatitis, should be of high quality and user-friendly, preferably WHO pre-qualified test kits. They are currently used at the hospitals as well as the blood banks. ELISA tests, viral load tests, tests are available, genotyping tests are available, but their use are limited. The public sector awareness raising activities have been increased now. The Ministry of Health now carries out the World Hepatitis Day events. Before that, they carried out the World Hepatitis Day in collaboration with Myanmar Liver Foundation since 2013. But now they are carrying out the celebrations at the national level. The National Hepatitis Control Program collaborates with the NGOs and INGOs and CSOs for the awareness-raising activities. Public sector facilities and limitations are present because although there is a policy, a gap remains in implementation of infection control practices. The National Policy on Injection Safety in Healthcare Settings recommends single-use syringes, needles, and cannulas for therapeutic injections. They are available in all the healthcare facilities. However, there is no specific immunization policy for healthcare providers and high-risk populations. There is a national infection control policy for all blood banks, screening for hepatitis B and C for all donated blood. National policy for hepatitis B, which includes birth dose vaccination, are limited to hospital deliveries currently due to intermittent supply of birth dose. So 20 to 25% of hospital deliveries are given the birth dose of hepatitis B vaccine. Previously, there is no routine surveillance for viral hepatitis, but starting now. The role of private sector in viral hepatitis control. So there are two main organizations, the GI and Liver Society and Myanmar Liver Foundation. GI and Liver Society are mainly educational and academic. Myanmar Liver Foundation is a non-profit NGO formed 6 years ago, consisting of mainly volunteers. So in the private sector, Liver Foundation has been claimed for undertaking notable efforts to raise awareness. Because we have celebrities, journalists, and media personnel in our foundation, we have carried out the awareness-raising activities at a very high level. Media coverage and networking are those. And we have also carried out vaccination programs all over Myanmar. So during the past 6 years, Myanmar Liver Foundation has screened and vaccinated approximately 500,000 persons with 3 doses of hepatitis B vaccines in collaboration with civil society organizations in the respective towns and villages. So these are the sites which are covered for hepatitis B vaccination during the past 6 years. We have vaccinated 500,000 persons with 3 doses. So priority is given to the high-risk groups. So in the private sector at Myanmar Liver Foundation, we try to have free tests, free drugs, as well as free consultation to reduce out-of-pocket fees for the patients. Myanmar Liver Foundation opened 2 charity clinics in 2 major towns, Yangon in May 2017 and Mandalay in January 2018. Free services are provided at the clinics, which include hepatitis B and C tests, hepatitis B combo tests, blood sugar tests, pregnancy tests, hepatitis B vaccination, ultrasound examination, fibroscan, consultation with trained medical officers and hepatologists, and free treatment for hepatitis B and C through donations as well as research projects. So this is the charity clinic in Yangon, and these are the number of patients obtaining free services at the charity clinic. So for hepatitis C treatment, we have given 846 patients through donations and 800 patients through research projects. For hepatitis B treatment, by donations, 70 hepatitis B chronic carriers, and by the research project, PKK research project, which was recently started, approximately 100 hepatitis B pregnant mothers and household contacts to be treated for up to 5 years as required. For cost-sharing basis, hundreds of hepatitis B and C patients are taking treatment at the clinic through cost-sharing basis also. So this is the end of my presentation. Thank you for your attention.